Good day. Thank you very much for joining us today for this conference, which is part of a series of lectures organized to celebrate our 40th anniversary.
Thank you very much for joining us today for this lecture, which is one of the Speakers of Renown series in our 40th on the occasion of our 40th anniversary. My name is David Malone. I have the privilege of working here at IDRC. I'm going to be sitting in the audience for this, and my colleague Lachlan Monroe, our Vice President for Strategic Planning and Regional Management, longtime resident of Africa himself, as I have been, is going to chair the session. We had wanted to focus this year on different parts of the world, and we've been able to, with a number of wonderful speakers. The penultimate winner of the World Food Prize was with us early in the year. We also had, not, I'm sure, as part of this series, but in public lecture format, the leader of the Alliance for a Green Revolution in Africa. Some of you may remember Namanga Ngongi being with us, I think, about 6 months ago. But all along, we'd focused on our governor, Amina Ibrahim, asking her if she would agree to speak, because her country, of course, is such an important one in Africa, and she plays such a hopeful, important role in that country. So we wanted to get a voice from the field, and she agreed to come a day early in order to provide this lecture. Amina's been on the IDRC board since 2007. We were extremely fortunate to snag her because she's in great demand. She is the Senior Special Assistant to the President of Nigeria on the Millennium Development Goals. She has played a number of roles in her country, but I won't embarrass her by sifting through them all. I'll simply say that she also is a very active participant in discussions globally on a variety of development dilemmas. She was educated in Nigeria and only towards the very end, I think, in Britain, and not for that long. And that's a very hopeful sign for Nigerian education, frankly. So I was very pleased to read that. When I was an adolescent during the Nigerian Civil War, my parents were living in Nigeria, and I used to visit often then. As a family, we fell in love with Nigeria. I still have a very strong, positive feeling for the country, as I think pretty well everybody who gets to know Nigeria does. It's what the French call un pays très attachant. So, Amina, I know that you have a number of interesting and provocative remarks for us, and Lachlan will look forward to making sure that there's a very interesting question and answer period. Donc, merci encore à vous tous, et avant tout, merci.
So thank you very much to you all, and thank you, Amina.
Thank you, David. Let me begin by thanking David Malone and his really wonderful team for giving me the rare opportunity to share some of our experiences with a wide constituency, I think, of not just development workers, but advocates in Canada. Canada's had such a long history with successes and challenges in its relationship with Africa. And I think, in fact, it can be said that Canada has been through thick and thin with us over the decades, and I know some of the ups and downs of our relationships in Nigeria, for one, when we were under the military rule. Canada, interestingly enough, is on track to meet its commitments that it made in Monterey 2002, and we know that we're topping the list in the monies that have gone to all the regions. And the relationship recently highlighted at the 2010 G8 Muskoka Summit, where Africa had 2 outreach sessions. Our president was part of those, and it was interesting that we were asked to speak about maternal and child health, which is a big challenge for us in our country. And by the time we'd got here, very quickly it was, could you please take the role of speaking on peace and security? So they were important sessions, the socioeconomic development side of it and the security challenges. One of the key outcomes of that summit underscored the urgency and the need for action on the challenges of maternal, newborn, and child health, for which Africa has some of the highest maternal mortality rates. And Canada had made a commitment here, about $2.8 billion over the next 5 years to the fund. And this was underscored at the UN summit just recently. The Secretary General's Every Woman, Every Child was also reinforced with commitments from many of our countries. It's important that at the AU summit recently, this was one of the issues that were discussed, the outcomes of the G8 summit. And for many of us in Africa, we had been through many years of trying to make the Global Fund work. And by and large, for all the funds that are working, it has been able to deliver on many of our doorsteps for malaria, HIV, and AIDS. And so for us, it was about, let's actually call for the commitments being made for maternal and child health to become an expanded global fund. And to move that forward so that there's less burden on our countries with the capacity limitations that we have to actually put these resources to use now when they're most needed. IDRC, on the other hand, has brought a unique approach to addressing the research agenda in Africa by promoting many of our indigenous expertise while ensuring that you have the cutting-edge techniques with the highest academics and standards. The IDCR Africa offices continue to provide platforms that nurture research that are responsive to our needs in practice, and I think this is important. Often we have such a body of knowledge and research, and often it's not as useful as it should be for the short terms that we see our policymakers in political office. And the recent think tank initiative is one of these innovations, for which Nigeria has a couple of those. Interestingly enough, one in the private sector, civil society, and another one to improve government's public institutions. When I was asked to give this lecture, I was presented with a dilemma. My first thought was that as a non-academic with not much experience of the world of research, what on earth would I say to an audience that had come to expect extremely high standards of this lecture series? My task was made more challenging when I'd asked, what would you want me to speak on? And then I was told, anything you like, and that's just dreadful. So my decision was to speak from the field, where the work of the researcher has been so critical to many of our successes and provided the evidence for lessons learned as we document best practice. I've spent the past 10 years of my 30 years' work in Nigeria as a humble public servant, serving 3 presidents to date, in one after the other. I think I'm a cat with 9 lives, so 6 more to go, in often very challenging and complex situations. I think that is the reality check that we have in our country, that it isn't a conducive environment, that there are these challenges on a daily basis we have to try to muddle our way through, making sure that we keep our eye on what is most important of our mandates, making a difference in the life of our people. The focus of my work has been in basic education and more recently the MDG agenda. And so I regard myself as a development practitioner who has had the privilege of working in civil society, the private sector, and now the public sector. In my talk today, I'd like to share with you our journey over the last 5 years in Nigeria as we strive to deliver the dividends of a hard-fought-for Paris Club debt deal. We'll also try to show that against all odds, Africa can and does work, and where better to demonstrate this than in Nigeria, a country that has had huge potentials, even bigger challenges, and a face that the world chooses to see only through the dark lenses of squandered opportunities, poverty, civil strife, fraud, HIV and AIDS, and the list goes on. I believe that my Africa today is not the dark continent. In fact, I think it's a bright one. It's full of energy, huge potentials, a very deep pride, a resilience, a beauty, a passion, a faith, culture, and the will to succeed against all odds. And many of those odds are created, we know, by us, but many also by the inequities in this global village. When we here talk about Africa, one wonders which Africa. It's often quite alien to us. Is it the continent of 53 states, or is it sub-Saharan Africa, or is it the Africa that is often referred to as if it was a country and not a continent? Africa does work. This year alone, the UN report on the MDGs cited 20 countries that had made the most progress, and 11 of those were African. We know, too, that the financial crisis had wreaked havoc in the global village, and many of us have been affected on the poverty front lines. And as the world tried to pick up the pieces and sanction the wrongs, Nigeria, for one, took some of the most far-reaching reforms and sanctions in recovering much of the stolen loot that we had and in very lengthy jail terms. Other bright sparks have been that we see that Egypt, with its best practice in ICT, and from the foundations, some of the best practice that we have in early child care and education. Malawi, again, against all odds, the recommendations that it should not use subsidies in spite of the rest of the world using them, and the success of its green revolution, in particular as it affected maternal and child care. Ethiopia and the success in the massive deployment of health workers to rural areas, and that has reduced maternal health. And they've been best practice that they've shared with many of our countries, particularly in West Africa. Rwanda and its success in the place of the woman in all decision-making roles. When I was there recently, one of the things that we really looked to see, what really made the difference? How did that happen? And for them, it was coming out of the tragedies that they'd had, putting their aims and objectives into their constitution. Women have a place because the Rwandese believed that this was a constitutional matter. And perhaps that's something for all of us to learn. As we tried to make it part of our constitution recently, we didn't succeed. There was so much against that. We're still battling for affirmative action. And I think that, you come from behind there. Liberia with our first female president, and yes, many, many more of the good things that have come out. Yes, the glass is half empty, but it is full some, and that must be recognized for us to have hope and a valid reason to build on the strategies that we've used to succeed in filling that glass some. I'll give a brief background to the debt relief that we got, then speak to the development of the framework that we put in place to utilize the gains, the processes that we've been through in delivering these dividends, and the challenges that we've faced, and the solutions we came up to overcome some of them. Finally, I'll conclude with some of the prospects I see for my country, Nigeria, and my continent, Africa, as we continue to strive for a world of equity, peace, and socioeconomic well-being. Let me begin with our new dawn, the third try at democracy, 1999. Nigeria, a federation of 36 states in the Capital Territory, with 774 local governments. We've got an estimated population today of 154 million, and with a poverty rate of 54.4%. That rate masks the realities of the disaggregated data, which gives us some poverty rates in our northern states of up to 85%. A GDP per capita of $1,370, that's 2008. Net enrollment in our schools of 88.8%. And while we look to meet the targets, certainly quality has been a big issue for us on our education agenda. The under 5 mortality rate of 157 to 1,000 live births. The maternal mortality rate of 545 to 100 live births. Our HIV and AIDS prevalence has reversed to and reduced to 4.2%, and access to safe portable water over 59%. President Olusegun Obasanjo was sworn in for a 4-year term, and as he took office, he was handed the baggage of years of military rule that had resulted in the near collapse of public institutions, systems, and the rule of law. Shortly after his election, Nigeria joined 188 countries in the UN in 2000 to sign the Millennium Declaration, which laid out 8 development goals and a global compact between developed and developing countries. The significance of this is that as we signed on to the MDG Declaration, the baseline was certainly nowhere near what Nigeria's reality was in terms of infrastructure, in terms of systems and structures. The first 4 years were spent understanding and in the end underestimating the damage that was done to our country and our people's psyche. Our nascent democracy was taking root in an environment where the rule of law was not supported by a strong judiciary as part of government, and they had also become victims of the military era. managing Nigeria's expectations. Every Nigerian wanted to see the dividends of democracy the day after May 29th, 1999. Rebuilding a security system, beginning with the police force. I remember at that time the Inspector General of Police that took over took one look at it and said, this is going to take a generation, because the police force had been decimated in our country to absolutely nothing. And to start that all over again, we were starting from minus. Bringing in fiscal and monetary discipline to the economy while embarking on the quest for debt relief. All of this at the same time. In 2004, Nigeria was still paying back debt accumulated in the military era. And in most cases, that debt had never performed. These are loans that were taken for white elephant projects, never made much difference in the lives of the poor. But it resulted in a huge debt burden of over $35 billion. In June 2005, Nigeria celebrated the debt relief negotiated with the Paris Club, and we bought back much of our debt, while the balance of about 19 billion was written off by the Paris Club. The savings that accrued to both the federal level and the state levels of our government were in a ratio of 75% to 25%, respectively. And the deal presented a significant opportunity for Nigeria to scale up its investments in the poverty reduction agenda and reinforce its economic reforms. When you sat down at the economic
Lorsqu'on a parlé de la façon dont on allait réformer l'économie et quels sont les investissements qui allaient être faits, c'était toujours le montant forfaitaire. Pour le secteur social, n'était pas perçu comme portant un bon rendement et contribuant à l'économie. C'est plutôt comment est-ce qu'on va construire l'infrastructure, le pouvoir, et très peu de lien avec la...
While we were celebrating the debt relief, many Nigerians were critical of the cost of that debt relief. And while the Paris Club, the members of that were very anxious about how Nigeria would use these savings. Was it going to end up down another black hole? However, from the onset, the administration of President Obasanjo, with the credible efforts of our then finance minister, now the managing director of the World Bank, Dr. Ngozi Konjo-Iweala, and her team, was determined and committed to using the resources transparently. It was important to gain the trust and confidence, not just of Nigerians, but of our partners, so that these investments would begin to flow our way. Nigeria's debt deal enabled the country gain about $1 billion a year, which would have been otherwise paid in interest and scratching at the capital. At the same time, we had also put in place far-reaching reforms through a strategy called NEEDS, the National Economic Empowerment and Development Strategy. And since then, had further developed the 7-point agenda and our Vision 20, of being one of the top 20 economies by 2020. With the debt relief under our belt, the next challenge was to make it work, and not just for the economy, but impact in the lives of the poor. In 2005, while I was working on the National Education Plan, we had, in civil society, been advocating for a national education plan. I think we'd made so much noise that they'd said, well, you better come in and do it. I think they were just trying to silence us. But it took almost 4 years to get a national development plan, one that wasn't just representation at the federal level, but really to go down to local governments and the states. And as an advisor to the president, I was asked to take on the mandate of designing a framework that would utilize the debt relief of $1 billion per annum. This clear objective was to have an impact at the local level and use the MDGs as a guide to structuring the investments through government institutions. In addition, it was also an opportunity to ensure we leveraged both public sector and public expenditure reform, which was ongoing at that time. So rather than take this money and put it in a special fund and just dedicate it as an ad hoc investment in the poor, we were putting it through systems. We were trying to fix government because it wasn't delivering service at all. And at that point, public expenditure reform was gaining some success. Discipline was coming into our public expenditure, but the public sector reform left much to be done. And we believed that the only way we could really address that and signal the flags of where the gaps were was actually to put our money through it and to see where these were. To maximize political commitment at the highest levels and ensure accountability to both Nigerians and our development partners, our office was set up reporting directly to the president, and as a deliberate policy did not have an implementing status. I think this is important to note. I was very much a part of the Petroleum Trust Fund that was set up in Nigeria under General Abacha. And that time it worked very successfully. However, that was an organization in a military era when things had collapsed, and what they were trying to do was to utilize at least some part of the resources well. In a democracy, this would have undermined the whole principle of having government and institutions deliver to our people. In addition, a presidential committee on the MDGs, which is chaired by the president, it has 43 members, and around this table are representation of our governors, of the key ministers who play a role in spending the money, implementing the programs that we have targeted, the private sector, civil society, and the development partners. And we hold this meeting quarterly. It had started in the beginning just to account for what we were doing with the resources, but at a wider level, we began to question how much the investments were doing in all other tiers of government towards the poverty agenda. We also set up a secretariat so that we'd have the institutional memory, and within the transitions, we were able to give some continuity. The framework for achieving the above objectives was design Nigeria's first virtual poverty fund, and it was coined OPEN, Oversight of Public Expenditure in Needs being the economic reform, again saying that we wanted to try to domesticate this, and OPEN just signifying that we were hell-bent on being transparent and accountable, that anybody would be able to question what we did. And it did provide an opportunity to set the scene for reinforcing the reforms that we talked about, particularly through the annual appropriations by Parliament and providing both an institutional tagging and tracking mechanism. We actually visited Tanzania. It was said to be the best practice for the Virtual Poverty Fund, and found that it hadn't actually got off the drawing board. I think probably the resources that needed to be dedicated to it. When one looks at Tanzania's funding basket, you'll find that most of it comes from the international community. So this was a real opportunity for us to make something like this work. The funds were targeted at the key MDGs where the challenges were greatest, while finding a balance between the need and absorptive capacity. So we may have needed lots of money to go into maternal and child health, but we looked at the absorptive capacity of our institutions to deliver those resources to the local level. We found very big challenges, and so we looked to see which of those agencies could we begin with while we were building back systems with other agencies to deliver better in the years to come. Key was also the condition that these resources were planned as additionality to regular budget allocations, thus scaling up investments and the impacts towards the MDGs. This was important because we didn't want this to replace what was acknowledged to be existing resources. In a few years, we began to see it replacing some of our health investments in immunization. But because we're tagging and tracking, it was being monitored. It was very easy to argue this with the National Assembly, that while the executive was suddenly replacing it with tertiary investments in health, we were very quickly able to bring that back aright. In some cases, this hasn't happened, and I will explain that as we go on. We looked at the investments we made in the Ministries of Women's Affairs. We had set up a core team at the beginning. A lot of what was complained about, there was a lack of inclusiveness in the planning of what we did. Much of what we heard in civil society, of course, is that community involvement was insufficient, and it's still there today. We have much work to do. But when we came back into office, 2005, even the ministries, those that had the responsibility of utilizing resources to deliver service, were not aware of the budgets that they had. They were, in fact, in the domain of the permanent secretary. And this made it very difficult for them to plan or to engage and take ownership. So we created a core team to guide us on this: finance, budget, the debt management office, and our key development partners. Again, the amount of overseas development assistance that comes to Nigeria is a drop in the ocean. But what does come, often we find distorting what we do on the development agenda. In a few states, Nigeria is broken up. 3 states here, 5 states there, 6 states here. No one can take the country as a whole. And so we thought, from this, did we not bring on the development partners to see how best practice could reinforce and better the use of our resources? So from the onset, the debt relief have therefore been an integral part of the budget process and subject to the scrutiny of the legislator and the public at large. Targeting the poor within the framework of the MDGs, maybe a little explanation here, because the MDGs have always been argued as to, are they good enough? Are they go deep enough? Are they wide enough? I must say that I was on the EFA agenda, so when I was asked to work with the MDGs, I was horrified because it just took 2 of the 6 goals, and I thought this was real marginalization. So let me start by saying that the MDGs are not the magic bullet for achieving socioeconomic development in Africa. They are a result of a world that failed to achieve wider development agendas by 2000, such as EFA, health for all by 2000, water for all, and so it went on. However, they are a set of objectives that bring together the minimum requirements for a solid baseline for beginning the journey to our promised land. They also underscore the importance of an integrated development agenda with the poor at the center, and for us, these are mainly our women and children. They provide an entry point around which, for the first time, there is somewhat, albeit shaky at times, a global compact between developed and developing nations to act for and on behalf of humanity. The reasons we chose this framework, beyond being one of the 188 signatories in 2000, is that it gives focus to issues that we have not addressed sufficiently and that are an integral part of our Constitution, which then makes them a right and not charity. This was important at the beginning. We were asked to bring the MDGs and domesticate them, bring them home and domesticate them, and we found that that was not a difficult thing to do when you read through our Nigerian Constitution, that much of these are demanded of government. There was also consensus around the need to achieve all of the 8 goals. All have a direct impact on the majority of our people. Not many people would stand up and argue against achieving basic education or looking at child and maternal mortality rates to bring them down. Even though we talk about our successes, they're still extremely high. It provides the basis for ensuring that when a country like ours achieves commendable rates of growth, which we had done since 2005, 2006, the measure of that success should be seen in the betterment of the lives of our people. Today, we have a vision to be one of the top 20 economies in the world by 2020. While many may argue that this is ambitious and rather aspirational, we believe it is a path that we have to take. However, we must also look to move in equal strides up the ladder from the low level of 158 on the HDI 2009. So where are we on the MDGs? Today in Nigeria, we have, as I had mentioned earlier, poverty rates of 54.4. While access to education is on track, the quality and the relevance of basic education is being threatened. The recent 80% failure in the examinations that we took this year were such that we had to call, the president called a presidential crisis meeting on education. Gender equality, while being addressed by adequate policies, is not being translated into economic empowerment, political participation, and decision-making roles. Although I must say that I thought I would bring a paper here today because as I was leaving Nigeria, we have elections coming up, and this is what we had. Women politicians are coming. What is significant about this? It's a northern paper. In our country in the north, the last to join the political race would be a northern Muslim woman. And for this, the majority are that. And so it is significant for us that at least we're being given the opportunity to engage. Next will come the actions to get into office. The child and maternal health that has seen some major successes recently, but continues to have levels of mortality that are unacceptable. So while we talk about 30% drops in maternal mortality, yes, the strategies we've used are very, very successful, but the scale at which we have to go and the capacity to engage with that scale is considerable. Malaria is still our #1 killer, while TB and other diseases threaten to come back. HIV and AIDS has been reversed, but still remains high, while the transmission from mother to child is of great concern. It's important here again, when we talk about Nigeria, we do disaggregate where all this is coming from. The epicenter for HIV and AIDS today still remains at a very high 10%. So while the country as a whole has reversed that trend, there are still pockets where we need to make strategic investments. Access to safe potable water has improved, but much remains to be done with adequate sanitation, while the environment and climate change begin to take their toll and threaten to reverse many of the gains in food production and health care. Finally, the 8th goal, that addresses debt, trade, and aid, is challenged by weak partnerships, genuine commitment, and mindsets not in tandem with long-term investments for sustainable development. In a nutshell, the MDGs have made progress, but insufficient at the current rate for us to achieve the 2015 target. So you may now ask me, so Amina, what's working? A lot is working for the poor, albeit insufficient, but enough to deserve more attention and investment to reach the goals. This means more and better coordinated domestic investments and promises met by our partners while making the increases necessary to fill the gaps. So we still haven't met the commitments, and the gaps are increasing. When the aid doesn't come in time, those needs increase. They don't stand static. Our populations are growing, the needs are growing, and institutions will continue to fail unless we can shore up that failure. In order to address the gaps, we targeted the debt relief in 2006, the first appropriation, at the following sectors through our federal ministries, departments and agencies: health, education, water, rural electrification, rural roads, women's affairs, and our poverty agency. The review of these investments in 2007 constituted a shift to direct transfer of funds to states for local level projects such as water, basic health care, and primary education. And this is important because when we first came in, the federal ministries were very powerful, and they insisted on these resources as part of their rights. And there was no record to show, while we all knew they had not been performing, there's nothing documented per se to say that these monies were not utilized correctly. So we had to go through the painful experience of knowing that that first year would largely fail, but that we would try to protect them and we would try to document what had gone wrong and to bring that to the table to argue for a transfer of funds more directly to the local level. And we were able to do this. Much easier now with the National Assembly, especially with projects like primary health care centres, portable water, which is just a borehole and shouldn't have been implemented from the federal level. We did this through conditional grants to states. We faced a lot of opposition with the conditional grants to states because the same question you often ask of Nigeria: if we give these resources, how are we sure that they will be used judiciously? It's the same question, funnily enough, we were asking the states. And people were saying, Amina, you have to be crazy. These governors are going to steal the money. But my opinion was that, you know, all three tiers of government in Nigeria, just different levels of corruption. Corruption wasn't state governments alone or local governments, it was even at the federal level. What was important was for us to put checks and balances in place that would ensure that it doesn't happen. But if we will continue to say that we're not giving it to governors because they were going to steal it, we would fail. We put in these conditionalities, and so far, 3 years down the line, we can report 95% success on those resources. I must say that some of those conditions were tried. The major condition there was actually to secure it with a bond, so that when states and governors didn't do what they were supposed to do, they would return those resources. And 2 states tried it, quite powerful states, one in the north and one in the south. And by that time, I had gone to see the late president to say to him, I'm going to have to call the bond on 2 governors, hoping that, you know, we would not cause too much trouble. And he was quite willing. He said, go ahead and do that. We called the bond, and within the space of 6 weeks, both governors rectified the expenditures in the areas that they needed to do. So we knew that you could put in the sanctions, you could have the checks and balances. In 2008, we had to deal with another phenomena. And as I say, really the reality check in our country is that every day there is a different challenge. And it's not in the books. It's not in the theory. It's one that you have to use everything that you know, everything that you've been taught, and everything that you've experienced to try to address it. The phenomena of parliamentary constituency projects. I believe that we have a lot of this in most parts of the world. I think I don't know what they call them in Canada, but I know in the States they're called pork barrel projects. For us, constituency projects, a major issue. And by 2007, 2008, in fact, the president had said no more constituency projects. They were distorting the budget. These were projects that were the responsibility of local governments and states, but were in health and education, affected the lives of the poor. Until we had a time where obviously we had to do constituency projects. And what he did was to throw it at our office and said, well, you're about the poor, make it work. When you have to talk to 469 senators and House members about constituency projects that had never been in any fashion organized, this was a huge challenge. But again, the MDGs came to the rescue. There was a framework. Really, what they did want were those 3 things: health, water, and education. Additional classrooms, additional boreholes for access to potable water, and also primary health care centres. And so this was, for us, an entry point to increase the impact, but we had to plan it and order it. We have today over 5,000 contractors deployed to do this. And remembering that we set up my office not to implement, so that we would remain independent and we could raise the issues and the red flags when they came, and we were suddenly faced with probably the biggest implementation challenge anyone would have to have. And we went through quite a lot, as they say, of panel beating on the floor of the House of Assembly. But it has gone to places that we never would have gone even as a federal government or a state government, really remote areas. It has shown us that there is a necessity, an urgency for local government to be empowered to sustain these projects. Many of them have been built, but what about the human resources? What about the maintenance of those boreholes so that it continues? How do we check the quality of water so that we're not left with epidemics of cholera or for lead content, in which we had seen just recently? The projects, as I said, have been executed. The debt relief investment pattern from 2006 to 2010 has been illustrated, I think, in the following slides. I'm going to do something now that I'm supposed to change, and it's supposed to work somehow. Yeah. Okay. And really, these are just two slides to demonstrate the distribution of the debt. And from 2006 to 2010, we can see that the majority of it has gone to the health sector and to education, water and sanitation. The other smaller amounts, important. We tried to do the rural roads, which we believed would take some of the post-harvest losses out to market. We looked at environment and housing by demonstrating that the housing policy really needed to see an integral number of inputs into reducing the impact of slums that were increasing on some of our urban centres. In terms of agriculture, we were also looking again at post-harvest losses. We were looking at storage facilities. The social safety nets that we engaged with were about conditional cash transfers to the marginalized, and we picked up specifically on those who are living with HIV and AIDS, the widows, those suffering from VVF, and then youth and women. When we first came in, the Women's Ministry got absolutely nothing in terms of a capital budget to do very much with. We, in fact, increased their budget over the last 3 years by about 400%. And then the others. It's important to note that while we design from the executive what we take to the legislature, often it comes back in a different mix. And this is what we have to negotiate pretty carefully. But I think that over the years, this is what we have ended up with in terms of those that implement, 65% at the federal level. And a lot of this money has gone to two sectors, education and health. Health because of the immunization program, which is regulated from the federal level. Also with the ACTs and the ARVs that we provided for malaria and HIV and AIDS. And then the issue of education has been that we have put into the system, recognizing the quality challenges, investments in teachers. We have put in a task force of 40,000 teachers, which is replenished every 2 years to our rural areas and in-service training for about 145,000 annually. Again, focusing on the key subjects that seem to have missed any attention: English, math, science, the very basics. However, to address the very high expectations of our people and reconcile the challenge of doing it all for everyone with less than often 10% of the capital budget, we designed a communication strategy and subjected our program to the widest array of audit mechanisms. At this point, I just want to go through what would we do to really show Nigerians that we were actually spending these resources and making an impact. Insufficient to get to the 100% everybody expected, but I will tell you that Nigerians expect that with 110 billion naira, we should do what is expected of 4 trillion. The demand, the expectations to make a difference in the lives of the poor is very high. Communicating what we were doing, that the MDGs were not an ad hoc intervention, was also very difficult. I think even today you may go down some streets and ask, what is the MDGs? Some will point to the projects and will refer to what's happening in their villages. Others will ask you if this is a new toothpaste or biscuit. So really we still have a lot to do on the communication side. But accountability to the Nigerian people is important if we are going to change the way things work. And over the past 5 years, we've appropriated about $4.1 billion towards the attainment of the MDGs. The Parliament in the first year handled the resource allocation through a joint Senate and House committee. The second year, it set up a standing committee on the MDGs in the House and an ad hoc one in the Senate. And this is important because at one point, we were being called to defend the spend of the debt relief by 12 different committees at any one time. And we're just a really small office. So we said, this can't happen. We need someone to coordinate this. And in the House, this was quite well addressed, but there was a huge knowledge gap. We managed to get them to set up a resource centre, which they did within the Parliament. It has provided for better harmonisation and oversight of mainline items in the budget and has ensured where possible that the debt relief was additionality. We've also been called to the public accounts. There is a committee on public accounts, and they too want to know what's happening. We've been there about 3 times now, and often the public accounts are questioning their constituency projects. It took a long time to get it up and running, and that had been questioned in a big way. We've also had a 2-day public hearing on the work of the office over the past 4 years. This is the first independent platform, the first independent platform for monitoring and evaluation using the debt relief, bearing in mind the Presidential Committee as the internal check and balance. So the first thing we did internally was have the Presidential Committee. Second, of course, is the Parliament. The next framework that we set up for monitoring what we did from the field took some time to do. It's really that the commitment we had to all Nigerians is that we would utilize the resources transparently. And we were faced with a task of providing a mechanism that both Nigerians and our development partners would be satisfied with. We couldn't have government reporting on government because we'd done that so badly before, and we inevitably fudged the results because they were politically sensitive. The task took us over a year, and what we did was provide an innovative solution with a large amount of independence. And how did this took place in the partnership between civil society and consultants. We wanted to do 2 things. The money we were spending, were we actually getting value for money? In the primary healthcare centres we built and the boreholes we put in, or were people cutting corners because they were having to pay sums of money at different toll gates? This was very important to us, and so we engaged a group of consultants, architects, engineers, quantity surveyors, to go to the field and tell us whether the contracts themselves turned out to be what we found on the ground. The other side of the coin, however, is that you can have a primary healthcare centre, but it may be located in the wrong place. It may not have the human resources needed, no doctors, no nurses, no drugs. It will not deliver a service. That's the soft side of it. And this, we needed civil society to tell us what was happening in the field. Was the community getting a delivered health service? Where were the gaps? And so we outsourced this M&E to a national coordinating partnership between the 2 constituencies. If you thought civil society partnering with government was difficult, try it with the private sector. It was almost impossible. There were different regards for the capacities and expertise, different understandings of whether you should be paid the same. Architects and engineers thought they were way above civil society. These were just lowly people from the communities. What were you talking about? So it really did try us, but we managed to do it. And we have state representation. So we have over 82 civil society organizations and consultancy firms working on this in every state of the country. We found that as difficult as a partnership was, but it did provide feedback on both value for money and the impact of public expenditure, the service delivery. And the independence of reporting was in large part due to government allowing the tools that were used for measuring and reporting on us to be designed by the teams. Another accusation was that if we paid civil society to do this, they would be co-opted, so they would be the mouthpiece of government. We have to pay them because the logistics to this, they have to go all over the country, putting groups together, paying for it. It can't be done on fresh air. So the tools that they used to measure were left in their own domain to design and to implement, and they have now a live portal that they use getting real-time data to the center and communicating that. There have been problems and challenges with the mechanism itself. While it has been a success, we continue to improve upon it with annual post-mortem workshops. Some of the most difficult things have been that huge body of knowledge that's come from the field, they've not been able to synthesize that information and to make the recommendations that would really improve public expenditure. This is a gap that we're looking at with our academics and research institutions to see how can we build that capacity. The third intervention to improve M&E was to flag the gap of national framework for M&E public expenditure. Again, when I said we were trying to make an impact on public expenditure reform, we found very quickly that we didn't have a national framework for reporting on what we did with our resources. There were many. In one department, in one ministry, we had 11. Most of them were monitoring. Nobody was evaluating, and nobody was documenting any feedback. So we developed a framework, and together with the National Planning Ministry, this has actually formed the basis for the Vision 2020. And we're currently supporting the setup of that mechanism. At the same time, we observe that there's a gap in wider society, a platform for the M&E expertise. This was really a new thing that we were grappling with. There was a lot of budget tracking, but very little to do with the projects and programs. So we did help birth an association to fill this gap. We've now handed that over to the professionals. This was done in 2007. The fourth is the ongoing study by the Dutch and Belgian governments, the Paris Club group of creditors. It's expected to be concluded in early 2007. Again, for them, how did the debt relief work? And they needed to know what impact did it make, what sort of institutions had handled it. The fifth, the media roundtable set up earlier this year to improve the information flow, to ensure credible feedback to the public. And in addition to all of this, we've tried to provide as much documentation as possible. We'd also embarked on state tours so that we would see this on the ground. The usual state tour would be to see the governor. Difficult, we have to see the governor's wife because first ladies are important in Africa. And in Nigeria, we take the first ladies all the way down to the local government. So local government chairmen have first ladies. That in itself is a huge challenge on our time and resources. But we try to integrate those meetings with youth and women so that they would also be brought into the discourse. Traditional rulers, which you will have heard maybe, maybe not, the recent successes with our polio have been the involvement of traditional rulers and communities in remote areas. So as you can see, we have had probably the most audited program in Nigeria, and that's a really good thing. It's an extremely good thing because what we want to be able to do is to translate that to other parts of our government. So what have we delivered and what has worked? And I know the time we have is pretty short, so what I had tried to do, and I think you've got some of the documentation in front of you, is to talk, because each one of these interventions over the period of the last 4 years is another lecture, whether it's the health sector or the poverty or whatever it is. But the deliverables that we have had on poverty, eradicating poverty and hunger, we've looked at different aspects of how we would target this beyond the investments that the country has been making in infrastructure and the economy. We've looked at what we call the National Youth Service, our graduates that have to do 1 year's youth service, suddenly not finding a job. And this was very important for us to listen to what they were saying. They had no future. So we did additional skills acquisition for them, gave them some entrepreneurial training and credit, and found many of them going into business and making it work. We had over 7,400 of the NYSC and 5,400 youth who had had leadership and entrepreneurial training. We also trained a number of agricultural enterprises that were created through the microcredit, the development of several anchor projects in the fisheries, in microcredit. It's been quite difficult to address microcredit because for a long time, the frameworks around them, you would have the resources, but the conditionalities, you could see the money, but you couldn't touch it. We had a huge agricultural loan recently and had to review that with the partnership of AGRA to try to make that more accessible. Our banking system also not very helpful, and much of what was we were asked to provide, particularly women, you found many barriers to this. Just going through this, universal basic education, I've said here we've a large number of teachers that we have focused our attention on to ensure quality. We've looked at the retraining. I mean, we found the teachers, I have to say, we did a biometric on our over 300,000 teachers and found that quite a large number of them, in fact, probably over 30,000 of them, didn't have the sufficient ability to teach beyond primary 4. So this was a big concern for us, and we went back to the drawing board and then began to invest in the teacher production centers, the colleges of education, look at the qualifications, look at the curriculum. Was it just about the infrastructure or the equipment? We needed to look at that. We also addressed some of the girl education program, which has been very successful in partnership with UNICEF and the World Bank. Again, supporting the increase of classrooms and libraries, computer centers. Promoting gender equality. Again, here we had provided a large number of the policy documents that were needed and a lot of advocacy to see that we could translate much of what we were saying on the gender equality situation in our budgets. We wanted to see that the Ministry of Women's Affairs was not putting a capital budget through to build primary health care centers or girls-only schools, but that they were using their advocacy and the tools that we had helped them design to ensure that the budgets of all the sectors adequately represented the needs of our women and girl children. But we have another phenomenon in Nigeria. It's a huge one. So in as much as in the north we were looking at educating our girls, the boys were falling out. What we had, I think here probably you refer to as madrasa, here we say al-majri, these are the street boys who were in our Quranic schools. And the same educated girls are the ones that you want to marry these young boys. No education, nothing that would help them be of any value to the community, talk less themselves. So we had to put a big focus on that. We have about 6 million of them currently in the country. We had a number of dropouts in the southeast. I'll say that, you know, the role of education is so important. The boy dropouts in the southeast, we have some of the most educated women in the country come from the southeast. Our graduates, our professors, they're from the southeast. But they have some of the highest rates of widowhood rights abuse. They have some of the highest rates of violence against women. And you look to the other side and you find that many of the men had dropped out, had become apprentices, had joined the trade, became very wealthy. And so for them, women became a possession. Didn't mind the education, actually. The more you were educated, the higher the price. And this really was a complete contradiction and questioned the integrity of education for what. So again, a focus on looking at taking education to the boys in the market. You couldn't stop them earning that living because poverty is an issue. So we took education to them. Reducing child mortality, again, focusing on getting as much as possible the primary health care system working again. A lot of what we had put in was procurement, vaccines, bed nets, ACTs, but we had left the gap where primary health care centers were no longer working. We're not delivering the services, not enough midwives, not enough nurses, not enough doctors, not enough community health workers. So while we were doing the hard side of it, the soft side was neglected, and that's something we put a big emphasis on in the last 2 years by trying to fill that gap. The exercise that we had on the polio eradication, with the right commitment, the right strategy, we have seen a 98% reduction in polio. The challenge now is how do we put routine immunization back to work and go beyond the campaigns. Improving maternal health, again, we have refurbished emergency obstetric care. We don't have the resources to rehabilitate a whole tertiary institution for referral health care, but we could focus on emergency obstetric care, which is what we did in all our federal medical centers, but strengthened the primary health care centers with midwives, and now looking to deploy about 5,000 community health extension workers to support that in the rural areas. We embarked upon our community health insurance scheme. Right now it's covering more than 600. We've just gone to 12 states, about 1.3 million mothers and children. That's improved service delivery. It has also improved access in some of the remotest areas. Environmental sustainability, well, we see that all of that for us is a challenge because as the climate change agenda came to Nigeria, we were really looking to see, is this additionality? Are we going to integrate this? How are we going to look at it? So we can see that we have been able to turn the resources into programs and projects that have worked, but they need reinforcing. The sustainability of much of our success is about building back local government, their institutions. And in as much it was a big challenge to go to the states, we're now saying we're going to the local governments. So we have a program to go to 113 of our 700 local governments, focusing on two things: health and education service delivery. How can we do that at the local government level? And we've been pleasantly surprised that, in fact, the capacity there is not as bad as we've thought. We've had 3 major workshops in different parts of the country, and there's a lot of enthusiasm for it. but we need more partners, and so we're looking to our development partners to reinforce our program by not duplicating what they've already been out there and done successfully in 2 or 3 states to make this a nationwide program. We do things in all 36 states and the FCT, but we acknowledge that not everybody can be everywhere. But let's take what is useful of what is working. We've not been without our challenges. Our environment which is our reality check, is not a controlled one, where the pilot is supported by a conducive environment. We work with the Millennium Villages project. I've always argued that a Millennium Village is in a very, very unique and well-prepared Petri dish, and everything is just right. And so it will work. There is no 2 ways about that. But take that out of the Petri dish and put it into the environment, and it will very quickly begin to show the cracks. And that's what we're challenging, is that if this is good practice, is this the right set of interventions for health, for education, for agriculture, as has been researched, as the evidence says, then let's put it into the system and see if it works. And that's the challenge. That is what we want to do. But we do want to change the mindset. As I said, this is our 3rd chance at democracy. When we say a broken system and weak institutions, we've neglected investments in our civil service, and they're expected to deliver. They're often blamed for every inadequacy that there is, and in some cases, rightly so. But in many of those cases, it's a neglect. It's a neglect of investing in the necessary skills that they need, the absence of planning. And often I come to give a lecture, I'm very afraid of talking about the statistics in my country, because often you're sort of crossing your fingers or your toes to say, well, you know, somebody else has got something on that. Our baseline is really quite incredible, not credible. A lot of what we have comes from surveys that have done over a period of 5 years. But in the health sector, we have made progress. The last NDHS in 2007 has begun to give us that baseline that we can build on, so that we can look at being more realistic about the inputs that go into our planning. Lack of accountability, governance structures, as I said, the cankerworm of corruption, marginalization of the poor has really affected our women. We've started to look at corruption not as a question of how much have you stolen or what toll gate have you put in place, but the cost of it we measure in lives. And I think it's the way you communicate that you try to win over the hearts and minds. Everybody has a heart and mind. It might have slowly started to become rather concrete, but you can chisel away at it. And we've seen that happen to many people who have been diehards about not investing in health, and passing the buck to the local government, come back to do that. So much of the challenges exist. We do need leadership at all levels. Often people look up to the president. It isn't about just the president. It's about his ministers. It's about local government chairmen. It's about community leaders. To send the message of leadership and what it requires has to go beyond what we perceive as just being the president. We also have faced a lot of cynicism even within our country. We've not been able to measure our success or analyze the gaps as well as we should have, and to communicate them. And that's something that we need to do better, so that we will get the mindset changed, that will look at solutions. It's always very much about why you cannot do it, not how can we do it. It's always about a quick fix. Democracy for us is extremely challenging. It happens every 4 years. That's like a project cycle. And there's no continuity. It's disruptive. We spend the first year trying to find a way to educate those that have come in, and then we spend the last year going for elections again. That's just a way, that just doesn't work for development. It won't work. We've got to find a way around it. And so institutions have to be rebuilt. People have to be invested in. And we have to encourage the linkages between each one of these investments that we make in health, in education, in water. So that's the empty part of our glass that remains to be filled, and urgently too. But as I've often said, it may be urgent, but we shouldn't be in a hurry to fail. We have a condition that needs to be addressed in the medium and the long term. There's always the low-hanging fruits, but ultimately we have to know what we need is sustainable, that it makes a difference to everybody. We've got 154 million people in our country. Everything that happens in Nigeria is pretty representative of what happens across Africa in different scales. So in consolidating on the gains going the last mile, at least for us, 2015 is a date that we have to meet. We've demonstrated that we found and used effective solutions to address our challenges. However, while this gives us the impetus not to give up and illustrates the to-do in concrete ways that we can all engage with and deliver on, the next few months, for instance, will be very difficult for us as we navigate another election. The fact that our president has committed to a free and fair election has made it even more difficult to achieve as we face those who feed fat on the status quo and attempt to destabilize the process. I wish I'd had a little bit more time, and perhaps IDRC, we can arrange that another time, to share with you the amnesty program in our country, because the recent insecurity in the country is not reflective of really what has been gained from negotiating our ex-militants away from the violence in the Niger Delta. And the amnesty program is something that has been homegrown and gone quite a long way with over 20,000 ex-militants. However, our government, and I believe most Nigerians, remain absolutely resolute in our demand for an enduring democracy, and that is a key component for stability and economic progress. We're also aware of the responsibility that Nigeria has in Africa. Often we're being told to stand up and lead, and people are waiting, or sometimes we'll be compared to much smaller countries that have done so much better. There is much that we can do in Africa, and as was said in the meetings recently in Rwanda, when we discussed the MDGs, we said included amongst the discussion should be the need to bring down those barriers that are economic and infrastructure within Africa. We can do that. Those are ones that we've created for ourselves, and so we can do that. And in addition, we should look at building bridges to the east while we rethink the way we mend and strengthen the bridges that already exist in the west but have been weakened in the recent past. And it is a way in which we think about that partnership. And often we're criticized for going so fast towards the east. But I think that we should be building bridges within Africa, outside of Africa, re-examine the ones that we have, look at the genuine partnerships in a way that is mutually rewarding and reinforcing of a world without poverty, not a quick fix. We said this to Bill Gates when he came to Nigeria, and he talked about the vaccine being the greatest public good. And the simple message we had from it is only as good as it is delivered. And he bought into that. He invested in the systems. And what did we get? With his help, we did get the 98% success in eradicating polio, so much so that I understand yesterday Ted Turner has also given us another $1 billion towards the immunization. So success does encourage investment, but we need to reconnect better. We need the research community to look at ways in which they can reinforce public policy decision-making in the short term, because, as I said, democracy provides us with that challenge. So, ladies and gentlemen, I hope that in this short time that we've had, we've been able to share in a nutshell what's working in Africa by putting a Nigerian lens on our efforts to improve the living condition of our people through the effective use of the debt relief, and I'll say against all odds. Thank you.